normal and weirdness section is we know that the cranial extent of C2 is this big, prominent, bulbous looking thing, and it should overlap and essentially touch the dorsal aspect of C1. So, and you should have this very small gap here. In dogs that have atlantoaxial instability, you have a huge gap there, and there's no overlapping of the cranial aspect of C2 over C1. So you have this big gap as opposed to this over here, which is normal. It's an easy diagnosis to make as long as you have a straightly positioned radiograph centered over this area. If you have a radiograph that's centered over the liver and you're trying to diagnose this, it's not going to look right. And you may miss the diagnosis, or you may make a false diagnosis. Okay. So you have to make sure, again, it's very critical to have nice positioned radiographs. And if you have an abnormality in this region, it makes sense to center the radiograph over that region and not do a whole body film. Okay. So again, this is diagnosed by increased distance between the dorsal aspects of C1 and C2. Here's an example of a normal dog on the craniocaudal view. You can see here's C2 right in here, here's C1. This little tooth-like thing right in here is the dens. That's a normal dens. That's what you should see. Here's another dog here, and you don't see the dens at all. So this dog doesn't have formation of the dens. It's gone. Okay, so that's aplasia of the dens. It probably never formed right. Here's another normal dog over here, same thing, but over here, there's a little bit of dens here. So that's not aplasia, that's hypoplasia of the dens. Either way, it's not normal. And when it's not normal, whether the dens doesn't form right, the den fractures off, or the ligaments don't form right, or they rupture, then you have an unstable joint, which leads to atlantoaxial instability. So here's a dog that, again, it's an endotracheal tube. We have a nice straightly positioned radiograph centered over C1 and C2, which is what we want. And this one here, it's a little questionable on this dog here. Here's that bulbous part of C2 that's kind of weird looking. It extends cranially. Here's C1, and it doesn't really overlap it, but it comes right next to it. So you're going, well, I don't know, maybe, maybe not. Again, you always want to put this in the clinical context with the dog. What kind of clinical signs does he have? But one trick that you can do, and I emphasize the word gently, you can gently flex their neck in that area. And so you just barely bend their head down, and then you take another x-ray, and you can make this condition here, this appearance, look like that, okay? Just by gently flexing it. And in a normal dog, if you flex their neck, even if you don't gently flex it in a normal dog, this gap should not happen. It should, C1 and C2 should stay very close together. And again, the cranial aspect of C2 should be right next to and overlapping a little bit over C1. So anytime you widen that gap, that means that joint space is unstable, which is this diagnosis. Okay. Why do you gently flex them? Because if you really crank on it, then you can actually put pressure on the cord and damage the cord, which, you know, obviously that's probably not the good thing, is make the dog worse than he already is. So you gently flex them in that area to see if that gap widens, and it shouldn't. Okay, so that's a pretty easy diagnosis, atlantoaxial instability. The great majority of these dogs will be very young, 3 months to 9 months of age, dome-headed small breed dogs. Typically, that's how they present. Okay, congenital abnormalities of the spine. Let's talk about some abnormalities of the vertebral bodies and the dorsal articular facets and the end plate that can happen. And some of these may or may not be clinically significant, but you will see them pretty commonly as you go forward. Okay, the first ones we're going to talk about are abnormalities that clinical signs that you can see sometimes with these dogs. A lot of times they'll be asymptomatic, but sometimes if they do show clinical signs, they usually do it in the first year of life. And a lot of times these dogs will be ataxic, they're kind of uncoordinated, so mild neurologic signs that may affect the front limbs or the rear limbs. The most common breeds are the chondrodystrophoid type dogs that will get congenital abnormalities of the spine. So bulldogs, of course, because bulldogs are genetic nightmares, right? Boxers, Boston Terriers, the chondrodystrophoid breeds, some Manx cats also because they're kind of weird, okay? And Shar-Peis. Who in here is a fan of Shar-Peis? Raise your hand, okay? Nobody is, okay? Shar-Peis, is not, them and chows rank up there as my least favorite breeds, just so you know. So anyway, so Shar-Peis can also show this. So the first one that we need to talk about is a block vertebrae. So this is a congenital fusion of two adjacent vertebrae. The great majority of the time, it will not show clinical signs, but sometimes it does, and I'll tell you why. So here's a cartoon. So here's a vertebral body and, you know, its dorsal process. Here's another one right next to it. So every now and then there will not be a intervertebral disc space between two adjacent vertebral bodies, and they're fused. They just form as one big block vertebrae. Here's an example of it. So here's a radiograph. This is probably the lumbosacral area. That's the sacrum. This is L7. There's L6. You can see a very small line, maybe an imaginary lucent line between the two. But for the most part, this is acting like one big long vertebrae, and that's why they call it a block vertebrae. This happens in people too. In general, when you see this, it's a congenital abnormality called a block vertebrae. Most of the time, it will not cause any clinical signs at all. And you say, ooh, he's got a block vertebrae, and you move on, okay? The only thing that this will do in time as the dog gets older, now we have, instead of a, you know, normal size length of a vertebral body, now it's twice the size. And so that creates a lever arm. And if you kind of remember back from physics what that is, so it will put undue stress on the intervertebral disc space in front of it and behind it over time. And so it may predispose the dog to have intervertebral disc disease in the intervertebral disc spaces on either side of the block vertebrae. But other than, and sometimes it doesn't do anything the entire life of the dog. But in and upon itself, the block vertebrae is typically incidental. Okay, here's an example of three of them that are kind of all joined together. So here's what, L5, L6, and L7, and all of them are kind of the same and kind of fused together, okay? Here is a partial block vertebrae. So here's C1, here's C1, C2, and C3. And if you look, the dorsal spinous processes are fused together between C2 and C3. The disc space itself is fine. So this one is a partial block vertebrae. And again, in and upon itself, probably doesn't mean a damn thing. Okay, hemivertebrae. What are hemivertebrae? Well, just kind of as the name would imply, it's basically a short or half of a vertebrae that forms. And hemivertebrae are extremely common, I should back up, in Boston Terriers and English Bulldogs and Pugs. Okay, Frenchies, you know, same thing. So those type of dogs, basically 99% of them will have hemivertebrae. For the most part, when they have hemivertebrae, like this guy here, it's a shortened kind of odd shaped vertebrae. It will cause a deviation of the spine, but typically that's it. They don't have neurologic signs. Most of the time, it doesn't cause them any problems at all. And sometimes they can look really bizarre and really weird and lots of deviation of the spine, but it doesn't usually cause clinical signs. So hemivertebrae, here's an example of one. So here's a normal vertebral body. Here's another normal vertebral body. Here's a normal one. Here's another normal one, but here you got this little short guy between these two. Okay, that is a hemivertebrae. It's kind of wedge shaped and about half the size of the other ones. And again, you show me a pug, a Boston Terrier, a Frenchie, a bulldog, and almost all of them will have one or more of these. Okay, here's two in a row. So here's a hemivertebrae here. Here's another one here. See how these are shorter in length than the other ones? And notice that there's also kind of a dorsal deviation of the spine in that same area. Here, again, this is very common in these types of dogs also. Here you have the spinous processes extending dorsally, but here 2 or 3 of them are fused together. So he's also got like congenital fusion of the dorsal spinous processes in this same area that he's got these 2 hemivertebrae. And again, most of the time, this is going to be incidental. And you say, yeah, that's typical in a bulldog or a Frenchie, you know, and you move on. The butterfly vertebrae is basically another name for a hemivertebrae. If you look on the VD view, sometimes they will kind of take on a butterfly shape, you know, whatever. Okay, transitional vertebrae. A transitional vertebrae is an anomalous vertebrae between most of the 99% of the time, you're going to see it at the lumbosacral junction. Sometimes it can happen in the TL area, but most of the time it's the lumbosacral junction. So between L7 and S1, where you get this transitional vertebrae. What do we see is, let me go show you a picture here. Let me show you. There it's, okay, this is a good picture. Okay, we'll back up, do those other slides in a minute. So in this particular case where you have a transitional vertebrae, basically you have a confused vertebrae on either side of either the lumbar spine or the sacrum. So in this particular case, this is L7. Remember, dogs have 7 lumbar vertebrae, but in this particular case, L7 is confused. L7 is looking at its neighbors, these sacrums, and it's going, man, I sure wish I could be a sacral vertebrae instead of a lumbar vertebrae, and it tries to mimic that. Okay, so it's a confused vertebrae that thinks, you know, I don't really know my own identity and I want to be like these guys. And so it starts to fuse with the sacrum and look like a sacral vertebrae. Sometimes also then you'll have the first sacral segment that's a confused vertebrae in life, and it looks at the adjacent lumbar vertebrae and it says, hey, you know, I don't really want to be a sacral vertebrae. I was born like that, but I don't really want to be a sacral vertebrae. I want to be a lumbar vertebrae when I grow up. And then you can get the opposite. So then you can have a sacral vertebrae that tries to mimic a lumbar vertebrae. And anytime you have these transitional vertebrae, which typically they will happen at L7S1, that leads to joint instability of the lumbosacral area, which can lead to problems. Okay, which we will talk about here coming up. So if I'm looking at this, let's go back here. So sacralization of L7 is when you get a complete or partial fusion of L7 to the sacrum. So that's where you have the last lumbar vertebrae, L7, thinks, well, I would rather be a sacral vertebrae. Lumbarization of S1 is where the first sacral vertebrae says, well, I would rather be a lumbar vertebrae. So basically, you have a malformed, confused vertebrae on either side of the lumbosacral junction that leads to joint instability and problems associated with the lumbosacral area. Here's an example of one on a VD view. And if you look here, this is L7, but this L7 is confused, okay? It has a normal lateral spinous process on this side, the left side, but it doesn't have one on the right side because it has fused with the pelvis. Okay, so this vertebrae is kind of, the right side of it thinks it's a sacrum. The left side of it thinks it's a lumbar vertebrae. It's internally conflicted. It doesn't know what it wants to do. Okay. Here's a real example of one. So here's L6 and here's L7. So L7 in this particular case has fused on both sides with the iliac wings and the sacroiliac joints. And you can see it's led to this joint space between L6 and L7 being nice and wedged. So this part's real narrowed, this part's widened. It leads to instability of that joint, which leads to disc problems. Here's the one we just looked at. Here's L7. This is the lumbosacral disc space in this particular case because it's a confused vertebrae of L7 and it's trying to fuse with the sacrum. How many parts does the normal sacrum have typically? It has typically a normal sacrum will have 3 parts, S1, S2, and S3, and they're all fused together. But here we have a 4th part. It's starting to fuse with the last lumbar vertebrae because it's confused. Okay, so transitional vertebrae, typically the bottom line will happen in the lumbosacral region, and you have either the last lumbar vertebrae that fuses with the sacrum or the first sacral vertebrae that will act like L7. And it leads to joint instability and lumbosacral problems. This is very, very common. I probably should, maybe I mentioned that up here. I don't know, but no, I didn't. This is super common. It should say right in here, dot, really, really common in German Shepherds. Okay. In fact, that we'll just add that in. Hang on just a second. No, wait, how do I do that? Here. What did I say? Really, really common in German Shepherds. Okay, perfect. Look at that. That's awesome. Go back here. Save that before I forget. Go away from there and go to here. Okay, back to where we were. So now it does say that. Really, really common in German Shepherds, which we're going to talk a little bit more about here in just a minute. Okay, abnormal curvatures of the spine. These are easy, but you need to know the names. So lordosis is a abnormal ventral curvature of the spine. It's called lordosis. Now, how do you remember that? all of these are named, these terms that I'm going to tell you here in a minute, all of them are named after, first named in people, right? And people walk upright instead of, you know, on all fours and horizontal. So the way I remember this, if this was a person, he would be, instead of pointing left and right, you know, obviously the head would be at the top. So if you have this ventral curvature and this is cranial, it's going to make you kind of look up at the heavens at the Lord, right? And so that's how I always remember that. It's a stupid way, but it's a way that you can remember it that's also politically correct, and it won't get me in trouble. Okay, so that's how you remember that. Okay, so there it is. The opposite of that is a dorsal deviation of the spine, which is called kyphosis. Okay, and if you look, a lot of times these animals that have kyphosis, it's due to hemivertebrae, like this guy here, that is a shortened squatty vertebrae. So chances are this is going to be some type of Frenchy bulldog, pug, something like that. And see, I mean, that looks pretty dang abnormal. It's very odd. It's very, you know, the deviation of the spine is very obvious, but most of the time this won't cause any clinical signs at all. They're just born like that. Okay, the other one and more common one that probably you've heard of is called scoliosis, where you have an abnormal curvature laterally of the spine. So the curvature goes either to the right or the left side, is called scoliosis. And again, most of the time it's incidental when you see it. There it is. Then we need to spend just a couple of minutes talking about another condition called spina bifida. Spina bifida is a congenital malformation of the vertebrae, and it's basically a failure of fusion of the dorsal arches and formation of a dorsal spinous process. So if you remember back to embryology, which we were all super fans of when we took it. So if we go back to embryology, remember we start off with this neural tube or the notochord or whatever it's called that ends up being your spinal cord. And you get these bone plates that are around, that form around it, right, which end up being your vertebral bodies. And normally they should fuse as we become, you know, once we pop out of the womb, right? So normally it should fuse to form the spinal canal, and you have the spinal cord coming down the middle of it. And the ventral aspect of the vertebral body should fuse right to left, and the dorsal aspects should fuse right to left, which then forms the dorsal spinous process. If you have a failure of fusion of the dorsal aspect from right to left of any of the vertebral bodies, that's called spina bifida. Okay. So what do you look for? Well, you look for two things on radiographs. On the lateral view or the VD view, you look for where there is not a dorsal spinous process because it didn't form right. So in this particular case, this is the lumbosacral area again. Here's L6. This would be L7. This is the fused sacral segments right in here. On lateral projection, same thing on the cranial caudal or VD view. Okay. Here we have a nice dorsal spinous process. On L7 though, it didn't form. Notice on the VD view, the dorsal spinous process is looking right out at you. It's coming right out from the computer screen at you. And it kind of looks like a little oval shaped or a little diamond. That's what you would typically look for on a VD view, the way they look. On this one here, you don't see it because it's not there, which is spina bifida. Okay. Sometimes that's one thing you look for. So the lack of a dorsal spinous process. The other thing that you can look for is on the VD view, again, they should be one little diamond is where the dorsal spinous process is coming right out at you. Here's one diamond here. Up here, we have two diamonds sitting right. This one looks like a butt cheek, but it's not. It's just two, you know, dorsal spinous processes sitting right next to each other. So again, the right and left sides didn't fuse right. Same here. Here they did, here they did, here they did. So you either look for the lack of a dorsal spinous process, or you look for two of them at one spot sitting right next to each other, which isn't normal. Okay. So here is a animal that has spina bifida. Here's L5, here's L6, here's L7. L5 has a dorsal spinous process. L6, I don't see one. Okay. Here's that little diamond on the end-on view that we can see on the VD view of L5. So this here is an end-on view of this dorsal spinous process is looking down at it. Okay. And we can see it here. Over here on L6, we don't see one at all. On L7, we pick it up again, and you can probably see it coming right through here on L7. So that's L7, but at L6, we don't see it. So that because we don't see the dorsal spinous process, that's a typical case of spina bifida. Now here's where we have two of them. So here's we have one spinous process, one, and then suddenly we have two. Here we have two, okay? So this one, they have them, the dorsal spinous process, but they never fused from right to left. Again, that's another case of spina bifida. Now, having said all this stuff about spina bifida, clinically, what does it mean? Typically, I don't know if I've ever seen a dog or a cat that has spina bifida that ever showed any clinical signs. Not that it can ever happen, but most of the time, these are totally incidental, but completely normal. I mean, not normal, but usually don't show any clinical signs at all. Okay, the next thing we have to venture off into is 3 different terms that you have to get straight going forward, that you just have to memorize the names and what they are and do they cause clinical signs or not. This one here is called spondylosis deformans. You will also hear other people call it spondylosis, just, for kind of, I guess, for short, okay? And I'll show you some pictures of it. Spondylosis deformans is present in probably 90% of all dogs and probably 70% of all cats that are greater than a couple of years of age. Typically, spondylosis is idiopathic. We don't know exactly why it forms, but may have something to do with joint instability between 2 adjacent vertebral bodies, okay? It can happen in any animal over about 1 year or 2 years of age. And typically spondylosis deformans shows it's an incidental finding and shows no clinical signs at all. And a lot of vets seem to get this wrong and think that it's a bad thing. So what you get your normal radiographs. What is spondylosis? It is a bony exostosis, which is a fancy doctor word for meaning I made some new bone, okay, that connects one vertebral body on the ventral aspect to its neighbor. So it's this bridging of bone between 2 adjacent vertebral bodies. You still have a disc space, you still have a disc, and it's very normal, but you get this connection between 2 adjacent vertebral bodies, and that connection is called spondylosis deformans. Again, is extremely common in all animals and typically is totally incidental, doesn't mean a damn thing, okay? Here's an example of a lumbar vertebrae with several sites of spondylosis. This is a normal vertebral segment here, so a normal disc space. So here's a vertebral body, here's a vertebral body, here's a nice disc space. We know there's a disc that lives in there, but nothing between the two. See this bony connection between these 2 vertebral bodies? And this one here is really obvious. This one here is starting to form. We've got this bridging area here. It's incompletely bridging. There's a gap here, but starting to form. Give this time and it will end up looking like this. Even though this looks very obvious and very apparent, and in somewhat really kind of nasty and gnarly looking, typically this doesn't mean a damn thing, okay? Spondylosis deformans, bridging bony buildup between the bones, whether it's incomplete bridging or complete bridging, it doesn't mean a thing, okay? So keep that in mind. Spondylosis or spondylosis deformans is totally incidental. It could look really bad. Look at this dog. I mean, he's got it throughout his entire spine, okay? And that looks really bad and really obvious. You're going, man, that looks horrible. But typically it doesn't bother the dog at all. They're fine. Okay. So spondylosis deformans. The next term that we have to talk about that is different, totally different, sounds a little bit the same, is called discospondylitis. Okay. And again, this is appropriately named for what it is. So it has the word disc in it. So it has something to do with the discs. And it has the word itis at the end, which itis typically implies inflammation or an infection. So maybe an infection of the disc when you see this, discospondylitis. Notice it does not say discospondylosis, spondylitis, okay? Discospondylosis is not even a word. So don't say, I think my dog has discospondylosis. I get that quite often in the history of, these vets, and I think he's got discospondylitis, and I politely tell him that, that isn't a word. Okay. So discospondylitis is an infection of the disc. So what do we see with discospondylitis? Here is a cartoon of a vertebral body. Here's another vertebral body. And between the two vertebral bodies, we have an intervertebral disc space. And in that disc space, we have a disc. So we have the disc that has the inner portion of it, which is the nucleus pulposus. It's full of like water, jelly-like stuff, kind of like a shock absorber. And around it, we have this fibrous covering, the annulus fibrosus of the disc. But in cases of dogs, this is normal. In cases of dogs with discospondylitis, we get an infection of the disc. It starts out in the middle of the disc. So it's a bacterial infection usually. And now it's infected, it's painful, and it starts to spread into the end plates of the adjacent vertebral bodies, causing bony lysis. So it invades and causes an infection of the bone itself of the adjacent end plates. That's discospondylitis, okay? So what do you see radiographically? Here's two adjacent vertebral bodies. He also has spondylosis, which doesn't mean a thing. But if you look, there's this area of bony lysis of this end plate, and the adjacent one right next to it, it also has an area of bony lysis. Here's a really bad case of severe discospondylitis. Can you see, this is a normal intervertebral disc space. Here's this end plate here, it's well-defined, and its neighbor of that vertebral body, also a well-defined end plate, nice well-defined disc space. This animal here has discospondylitis. The end plate is narrowed because the disc is probably ruptured, it's infected. And look at all this ratty, lucent area of the adjacent bone of the end plates next to it, because this is an infection. So that's an osteomyelitis or infection of the adjacent end plates of these vertebral bodies and a narrowed disc space caused by an infection in that area. That's called discospondylitis. Totally different than spondylosis deformans. Discospondylitis causes extreme pain in these dogs. I think end plate lysis, yeah. And it causes extreme pain here. Usually these dogs that get this are young. So a lot of times they'll be large breed dogs, 1 or 2 years of age. They'll a lot of times present to your clinic in extreme pain to where when they walk, they're just screaming out in pain. I mean, this can hurt. Typically, this will happen in one and usually more than one site. So if you see a dog and you suspect a discospondylitis lesion, you should take lateral views at least of the rest of the spine, cervical spine, and the entire TL spine, because a lot of times it'll happen in multiple sites. Okay. It's typically caused by a bacterial infection, and most commonly by the most common bacteria that are out there, staph or strep. Sometimes it's caused by E. coli, and extremely rarely by this guy here called Brucella, okay? Which that's a bad thing because people can get that and cause problems, but that's also pretty damn rare. So most of the time it's just staph or strep. This disease, discospondylitis, is a veterinary rock star disease, right? And why do I call it that? Is because there's some diseases that will make you as a veterinarian a freaking rock star in the eyes of this owner, and maybe the animal too, who knows, right? So this is one, because these dogs, one day they come in, they don't even want to walk. They're screaming in pain. It hurts like hell. You put them on high levels of aggressive antibiotics to treat this infection of staph or strep. And 2 days later, they're wagging their tail, running around all over the backyard. Okay. So you have it makes you look really good because you came up with the diagnosis, you treated it, and these dogs respond like that. Okay. The problem with these dogs, like any infection, is the owners go home and their dog's back to normal 2 or 3 days later. And what do they tend to do with the antibiotics? Well, he's normal now, so they discontinue them. They quit giving them. And we know that this condition will come right back once they're back off of antibiotics. Most of the time you have to treat these dogs not for a couple of weeks or 10 to 14 days with antibiotics. It may be 2 to 3 months long of antibiotics to really keep it under control and completely get rid of it. Okay. But again, it's a very treatable disease, and it's an infection of the adjacent end plates, typically caused by staph or strep. That is a rock star disease. Okay. So everybody understand the difference between discospondylitis and spondylosis deformans. One is a bad thing, but it's very treatable, causes severe pain. Spondylosis deformans, on the other hand, looks really bad, but it doesn't cause any clinical signs. The third term that is very similar to all of these is a condition called spondylitis. So this is the same as disco spondylitis, but this doesn't dance and there's no disco involved in it. Okay, so spondylitis is another, the itis means infection, which is appropriate in this case. It is an infection also caused by staph, strep, E. coli, or very rarely brucella. But instead of involving the end plates of the vertebral bodies like disco spondylitis did, this is an actual infection of the vertebral body itself. Okay, so in this particular case, we can get bony production or lysis of the ventral aspects of the vertebral bodies. The end plates and the disc spaces are fine, but now we get an osteomyelitis or an infection of the vertebral body itself, and it causes bony production and lysis of the ventral aspect of the body of the vertebrae. Okay, that's spondylitis. Okay, again, here's an example. So we said normally these vertebral bodies in the lumbar area will have this concave appearance. In this animal, we have a lot of this bony buildup due to an infection of that vertebral body itself. Here's L7, here's L6. And again, we have this fuzziness or this bony production underneath L6 and L7, consistent with spondylitis. These dogs, again, they're going to come in, they're going to be extremely painful, screaming in pain. You put them on antibiotics. This is another rock star disease, and they improve like that 2 or 3 days. But again, you have to keep them on antibiotics, usually for 3-4 months, to continue to keep this under control and actually continue to get rid of it. Okay. So we've learned about, and the other caution here, remember when we talked about the vertebral body things and the weirdness section that we talked about, I think that was yesterday. We said that the ventral aspect of usually L3 and L4 is fuzzy normally, kind of like this, okay? But that's where the diaphragm hooked on to the ventral aspect of L3 and L4. That's why I had to say that. You didn't know it at the time, but that's why I had to say it. You don't want to get that confused, which is a normal finding, with spondylitis. Okay. So we talked about 3 different terms now. We've talked about, just to review real quickly, and you need to know these, okay? Spondylosis, otherwise known by its full name, spondylosis deformans, is the bridging bony buildup of bone between 2 vertebral bodies, no lysis, just bony production. Totally incidental, can happen in the great majority of dogs, even when they're young, and it doesn't cause back pain. It's totally incidental, okay? But it can look really impressive. The second term is discospondylitis. Discospondylitis would be an infection of the adjacent vertebral body end plates underlined, caused by an infection of the disc that then spreads laterally to cause lysis of the adjacent vertebral body end plates. Okay, staph or strep, great majority of them, put them on long-term antibiotic therapy, they improve quickly and they do great, okay? Usually occurs young dogs, multiple sites. Spondylitis is the third term. Spondylitis is now staph or strep infection, but involves the infection of the vertebral body itself, not the end plates. Same thing, staph or strep causes extreme pain, can happen in any age dog, sometimes large, older dogs. And again, you put them on high levels of antibiotics and they get over it pretty quickly and they move on and they're doing their thing. Okay. So you need to know those 3 terms, and notice that none of those terms said discospondylosis. Again, that is not even a word. There is no such disease entity. So you need to know those 3 terms and know what they mean, because you will see all 3. Okay, then we're going to talk about intervertebral disc disease, which again is really common. It happens most commonly in the long dogs that have, long squatty bodies. So what's the #1 kind of dog that gets intervertebral disc disease? That is the neurologist's bread and butter, their money maker when they see walking in or maybe dragging into their clinic.
Dachshund?
Dachshunds, yes. Dachshund weenie dogs are the neurologist's best friend, right? Because they're very prone to intervertebral disc disease as they get older and even middle-aged and sometimes even younger dogs, okay? There are different types of disc protrusions that can happen. So we're going to talk just a little bit about that, and you'll talk much more about this when you take your neurology class. Again, chondrodystrophoid breeds, of which dachshund is the favorite one, and it can happen in middle-aged to older dachshunds, and it can lead to either back pain or complete paralysis. So these dogs can be totally paralyzed in just the rear limbs, to where they're dragging their rear limbs, they can't even move them. Or if it happens in the cervical area, then it may affect both front and rear limbs, okay? So radiographically, typically you get plain films of those regions. Again, you try to avoid whole body dogograms, even if it's like a small breed dog. And so if you think he's got a neck pain and a cervical lesion, we would probably want to center the films over the neck, not the TL junction. If he's got lumbar pain, we would want to center the films over the lumbar spine, okay? It makes sense, but you'd be surprised how many people just shoot a whole body radiograph hoping they see something. And usually it's a non-diagnostic film that way. So what do you see with on plain films with intervertebral disc disease? And I can tell you this right away, there's a lot of things you can look for, but the only way to 100% diagnose it is going to be with MRI or a special procedure called a myelogram, which we'll talk just very briefly about because hardly anybody does them anymore. So let's review anatomy real fast about the intervertebral discs and what's going on there. We've already started to mention this. This is a cross-sectional view through one of the intervertebral disc spaces. Okay, so if you look at this, here is the spinal cord itself. And of course, this is the spinal cord in this particular case is coming right out at you from the screen. So the spinal cord is sitting right in here, and it's in the spinal canal and surrounded by all this bone that is there to protect it. And around the spinal cord itself, you have 2 or 3 little layers of meninges that are around here, okay? There's one space around here, around the spinal cord, that is called the subarachnoid space, and that has CSF in it. That's where the cerebral spinal fluid flows around the cord. Then you have another space around that area that's full of fat, okay? It's just got a little fat in it. That's called the dural space, okay? Both of those areas, those meninges and those little coverings around the spinal cord are there to act like a shock absorber. If there is some type of trauma or incident, it typically will take on that blow and try to shield the spinal cord itself from being compressed, okay? Ventral to the spinal canal, which is where all of this lives, you have the intervertebral disc, okay? The intervertebral disc, the inside of it, has a jelly or water-filled part called the nucleus pulposus. And around that, you have this firm fibrous tissue called the annulus fibrosus that is around the nucleus pulposus. So it's kind of like a jelly-filled donut, if you will. So here's the jelly in the middle of the donut. This is the donut around it, okay? That's the typical normal anatomy of dogs and cats with intervertebral disc disease. Now we have to define 2 terms that go along with if you have an abnormality and a disc problem, okay? A protrusion is where we have the nucleus pulposus, and it is actually kind of starting to bulge the dorsal aspect of the disc, and then it can bulge and put pressure on what lives in the spinal canal, which we know is the spinal cord, okay? So a protrusion is a bulge of the disc that has potential to put pressure on the spinal cord, as opposed to an extrusion that is actually herniation of the nucleus pulposus content, that water or that jelly-like stuff, into the spinal canal, which will put pressure on the cord. So we have a protrusion, which is a bulge, and extrusion, which is herniation of the disc material. Okay. Also, keep in mind that in the thoracic spine, again, containing where the rib heads, we said the rib heads attach to the cranial aspect of their vertebral bodies, of which they're named for. And there is a ligament that attaches from the right rib head over dorsal to the intervertebral disc to the left rib head. And that is called the intercapital, which means between the 2 heads of the ribs, ligament. So the intercapital ligament occurs in the cervical, in the thoracic spine, typically right over where the disc lives. That is the good thing, because in these regions where this intercapital ligament exists, it actually acts like a cover or a protective mechanism that if this disc has degeneration and herniates out or protrudes, then it can't go put pressure on the cord because of the presence of this intercapital ligament. It holds everything in place. This intercapital ligament is present wherever there's ribs, but caudally to about the region of T9 or T10, it doesn't align with over the disc space. It's more in the middle of the vertebral body itself. And so it doesn't protect those spaces. So the presence of the intercapital ligaments in the mid to cranial aspect of the thoracic spine is why we hardly ever see disc problems in dogs between about T1 to about T9, because even if they had protrusion or extrusion of the disc material, it's never going to put pressure on the cord because of the presence of this intercapital ligament that keeps everything down and in check. On the other hand, after caudally to about T9 or T10, this isn't centered over the disc space, this ligament. And so that now, if we have a protrusion or extrusion, it then can herniate upwards dorsally and put pressure on the cord. So the intercapital ligament is actually a good thing. It protects the cord or the spinal canal if you do have disc problems, which explains why, again, it's very rare to have disc disease in dogs between about T1 and T9. Okay, here it just shows. So here's T9, here's the rib heads. So this black arrow is where the intercapital ligament lives. And you notice here it's centered right over the disc space. So even if we had a protrusion here, it can't get up into the spinal canal because of this intercapital ligament lives right over that space. But as we go further caudal and caudal and caudal, notice it's not aligned with the disc space. And so now if we have a disc protrusion here, it is allowed, that disc could go up and put pressure on the cord. Okay, so let's take our break here. We're going to come back and pick up with this slide about the cause of intervertebral disc disease.